Dr. Madeline here with Forward Spine Center, and today I'm here with Aemelia with Bellflower Lactation. She is a pediatric nurse practitioner and IBCLC who brings both deep clinical expertise and real-life motherhood experience to supporting families through feeding challenges. Thank you for being here.
Yeah, thanks for having me.
So we're really grateful for learning with you today. And tell us a little bit about yourself and your background.
Yeah, so I have a master's of public health in maternal and child health and international health, which then led me into nursing. And so I went to nursing school and became a pediatric nurse practitioner. And what I really realized I love within that is supporting the dyad of moms and babies or families and babies, and not just specifically focusing on sort of the individual like child health issues. And so then I went on to become an IBCLC, which is International Board Certified Lactation Consultant. And so now I am the owner of Bellflower Lactation. I've been in business for 4 years now. That's right. And I have 3 girls, 3 daughters. My oldest is 11, and I have twins, which we share in common, who are almost 8. And, you know, just the constant sort of all my education and training and like professional experience. And then also, like you said, the reality of just trying to raise these 3 girls. And certainly my nursing journey with all of them was extremely humbling. And I bring that into kind of all of what I do and how I support families.
That's awesome. That's awesome. So tell us more about the families that you support.
Yeah. So, you know, families come to me for really at different times. Yesterday I saw a baby who's like 2 days old, which is always so exciting. And then sometimes I'll see babies who are 6 months old or older coming in for the first time. A lot of times families kind of filter into me after they've seen several other lactation providers, just simply because maybe they weren't a great fit or they weren't getting all their questions answered. But I'm trying to we focus on lactation, but because I have my background as a nurse practitioner, I think I'm able to look a lot more broadly too. And also the cool part about what I do as an IBCLC, which is the part that like excites me, is if there's 1 mom and 1 baby, I have 2 patients, and I'm one of the few providers who takes care of a dyad in that sense. And so, you know, your pediatrician cares for the baby and your OB or midwife or family practice doctor sometimes cares for the mother, but I'm the one who's looking at both and trying to balance the care of both mom and baby at the same time, which just adds like kind of this exciting but unique challenge.
Right. And like they both are such big
They're both so important because so often, right, once a baby's born, we forget, we don't manage the mom. We don't treat the mom. We don't care for the mom, which as a mother, we know is tragic and very lonely, and all the focus goes to caring for the baby. But this ability now to sort of be able to come up with a plan and approach each visit saying, okay, I want equally good outcomes for the entire family is fun for me. I like that challenge.
So what are some common surprises parents face in the first couple weeks
of
postpartum?
Well, you know, I think it depends if it's their first baby or if it's subsequent children. I think every family struggles as the first baby comes home. I did as well. I imagine you did. Well, you had 2 the first time.
Yeah.
Oh my gosh. But I think, you know, just in that adjustment to being like, there is this I had this family yesterday. It was like, nobody like wanted to check anything. Like they just let us take this baby home. They shouldn't have done that. Well, that's how this works. But it's terrifying, right? To all of a sudden just realize you're responsible. And the demands of a newborn are beyond what anybody can expect. I mean, I worked for years in pediatrics and had done all sorts of care for children and babies. And I was immediately humbled the second I came home, realizing that like I was on my own, right? My husband and I were on our own with this little baby, and there was no.
And then you throw breastfeeding in.
And you
have no idea what you're doing.
Sleep deprivation, and it's really, really hard.
Yeah.
And we just don't have any great like system or structure, I think here at least, to really support that dyad in the proper way.
Like my kids were 32 weekers, the twins were, and I felt like I left that hospital with so much knowledge because of the lactation specialists and the nurses that I was introduced to, because you guys are so full of knowledge.
Well, we are.
Yeah.
But at the same time, there's some of just like, even if, I mean, I was those things, and I still brought my babies home being like, I don't know what I'm doing.
Yeah.
Because when you're in it and you're so sleep deprived, no matter what, it's so hard.
So how can families tell what's normal versus what needs a little bit of extra support? Because it is so all overwhelming.
It is so all overwhelming. I think such a good question because it varies. I will say generally, if you're experiencing pain with feeding, it's always a good idea to check in. Now, occasionally some like very mild to moderate occasional pain, as much as I'd like to say that's not normal, I think it is as we're adjusting to breastfeeding in the first week or two. However, if it's significant pain, like you can't talk while you're feeding, you're not breathing, you're crying while you're feeding, you're having a lot of damage to your nipples, those things those would be instances where I'd say absolutely reach out to an IBCLC. If you are just feeling really disconnected, I think, to yourself or to your baby, or like things are happening to you, but you're not sort of part of the plan, I think reaching out's a really good idea because parents should feel like they are sort of in charge of what's happening. And when things feel maybe too chaotic or you're just so sleep deprived because of the chaos, it's really hard sometimes to kind of figure that out for yourself. So having somebody help with feeding often can then help get a bit more sleep or come up with a plan that can maximize some sleep so we can rest and recover and be our best selves.
Do you consult with people before the birth?
I love to do prenatal consults.
Yeah.
The truth is a lot of people don't do them. I think because people think maybe they don't need them, or people are so focused on pregnancy and birth, they just assume feeding will happen. I hear that a lot from families. And at least with the families I see, it doesn't happen, right? It doesn't typically go well. So I think doing a prenatal consultation is a fabulous idea. And I offer just like a free 20-minute like meet and greet, but I certainly can do more for people too. If they want more of like an education and class type structure, we can do that too.
That's good to know. Yeah. How do birth experiences or like body tension affect latch?
Yeah. So, I mean,
feeding. Yeah.
I always say birth is traumatic, even if it's like good trauma, right? Like, obviously, we're happy to meet our babies, but there's like for mother's body and the baby's bodies, like that is a massive transition. And you can speak much more to this because you know beyond my knowledge, but certainly I see babies all the time with specific tension patterns. So babies that might be really archy or really tucked in, curved in, might be curved to the side, have a head turning preference. Any of that can have a huge impact on feeding because feeding has to be a midline activity, meaning we are feeding in the middle of our body to feed successfully. Just like if you think about it, we don't pick up our water and turn our head to drink, right? Mm-hmm. We do all of our eating here. And we actually do a lot of the same skills that babies need to do. So if a baby can't be comfortably here and even here, we already have trouble.
Yeah.
And sometimes that's little positional tweaks that we can work on. And I love it when that's the case because it's simple adjustments that families can make at home to have huge success. But families often, it's hard to see that when you're looking down this way, right? Like what to do. But absolutely tension and how we hold our body has a huge impact on how feeding goes.
So what are the common reasons why babies have struggling with lactation or with feeding?
I mean, I think sometimes, and the easiest one again to fix is just like, are we not lining them up properly? Positioning babies and getting that good latch is probably 90% of the battle with breastfeeding. Wow. And so if we can get that, fantastic, that carries us through, right? But then I see a lot of babies who are dealing with like tongue ties and oral restriction issues. And so, feeding, even though it seems like it should be this very like natural and thing to occur after birth, is extremely complicated. And a lot of babies do it beautifully. The series of events like happens reflexively and they do it. But for babies where that doesn't work well, then trying to teach them the series of events like that need to happen to get to a good latch on the breast can be hard. And sometimes there is true like oral restriction where we're dealing with something. You diagnose that. Yeah. And so the nice part of being a nurse practitioner is I have the ability to diagnose. And so instead of bopping families about to a bunch of different providers who say, I don't know, maybe this, maybe that, try this, as we can say, okay, let's get to the bottom of the problem. Let's figure it out, and then let's figure out the best plan moving forward. But certainly oral restriction will cause body tension.
And then down the road, it leads to a lot of
sorts of things. And where the tongue sits in the mouth affects how the roof of the mouth grows. And so I think sometimes families don't understand that, is that we are looking at how all the puzzle pieces fit together. And then in addition, now we're trying to figure out, how does mom's breast and nipple fit within that oral structure? And sometimes it works. We might have some limitations on baby's end, but mom's breast is good for that and makes up for the difference. And other times it doesn't. And so that's where really the idea of a tongue tie is not kind of just a look, fix it and move on. It's very much like, how does this fit together with this particular mom and baby? And what is needed to get them to their best outcomes?
Okay, so it's not necessarily always just fixing the tie. It's about more tongue function.
Exactly. Function is the key, because what things look like tells us a tiny part of the story. What the function of that anatomy is the much bigger and more interesting part, but the harder part to figure out, to be honest.
And then going back to like stress, exhaustion, and just emotional load, how that really plays a part in the feeding and the breast, milk letdown, and how you support that too.
Yeah. Well, I think so. Breastfeeding is largely hormone reliant, right? And so one of the key hormones for breastfeeding is oxytocin, which is that like lovely love and bonding hormone, and that makes us feel all fuzzy and warm, but it helps your milk let down, right? But what counteracts oxytocin is our stress hormones. And so when you're healing postpartum, even if you've had an easy delivery, right, it's still stress. When you are sleep deprived, when you don't have time to make yourself meals, when you're trying to figure out the cries of your baby, when you and your partner are trying to navigate like this new relationship and what that means, all the stress that comes with it has a huge impact on our ability to make milk let down, baby's successful transfer.
So how do you support the mom in that?
Well, I think sometimes just acknowledging.
Okay, so just
like
communication.
This is hard.
Yeah.
And what are the ways that maybe we can create some structure within the family to buffer some of that, okay. And that's like every family I think has to figure that out, but almost I want to say guiding or supporting partners to be like, how do we get you a bit more sleep? Right? Yeah. So you show up in the day a little bit more well rested and feeling better. Meeting our basic human needs as the caregivers is so essential to being able to successfully breastfeed and parent the way we want to. And I mean, you and I have lived that. I'm sure.
So do you work a lot with the partners as well?
I love when partners come to visits. I think it's so important because, one, everyone is sleep deprived, so they're probably hearing 50% of what I'm saying anyways, right? So if we have with two of them, maybe we'll get to 100%. And two, I think just sometimes partners don't know what to do. Like they love their partner and they want to show up in the right way, but like they don't know how. And so sometimes just saying like, you'll wash all the bottle parts, or you're going to take a nighttime feed, or hey, can you be the one to like remember for mom to take all her postpartum like pain meds or whatever it is. That can be such like an empowering thing to think, yes, I can do those things for my partner.
Well, and you think like 40 years ago, men weren't even in the room when women were giving birth, and now they're in the bath with them.
Yeah.
So it's like, what type of support are we giving males?
Yes.
Like and a lot of times they come away from birth, and yes, sometimes birth is beautiful, but sometimes it's not.
Yeah.
And that can be traumatic, and making sure that they're, coping well as well, and hand-holding them.
And, truthfully, their postpartum depression for men is a real thing. And I know firsthand that because my husband experienced that. And I was experiencing my own postpartum like depression and anxiety after my twins were born. So together, we were not in a great spot at that time at all. And I know it so intimately, and I care so much about it because truthfully, like mental health is much more important to me than how we're feeding our babies. I mean, obviously we need to be like healthy. We need a baby who's thriving, a mom who's thriving, but mom can't thrive if her mental health is not in a good spot. And she can't thrive if her partner's mental health is not in a good spot. So really, to me, that's almost the top priority.
Yeah.
And sometimes it ends up, I've had some families where I don't feel I'm giving permission, because I hope families always know they have permission. But sometimes the best advice I've been able to provide a family is, maybe it's time to let go of all this feeding
The
shenanigans.
expectation.
That maybe things haven't gone as planned initially, and sometimes moving into this new reality, giving yourself like the forgiveness and grace to just say, this is where we are right now, and from here on out we can find like a way to feel pride in that and settle into that, and a calmness in that, I think is really important. And I've had some families report that back to me, like, you gave us permission.
Yeah. Just like that third party that like
Yes.
comes in and just like takes a look back, like takes a step back and just looks.
Yes.
Like, what, maybe this is what the whole family needs.
Yes. And I think that's it. Like, I always say, probably some lactation consultants roll over in their grave when they hear me say this, but like, while I obviously love breastfeeding and all things related to breastfeeding, I don't think it's the be all end all. Like, I really think we can raise beautifully healthy, thriving children if the best option for that family is not to breastfeed.
Yeah.
And maybe I'll be, held accountable to that, but I believe in it so firmly. We have to be in a good spot as the adults and the caregivers, and our kids will be okay.
Well, that just shows like you're a wholehearted, you want what's best for the family. You want what's
really
best for the parents.
And I've lived it.
Yeah.
Like, I lived not being in a good spot. Yeah. And if I look back, I would have done things differently for myself if I could have like shown myself that compassion.
So this is kind of a trick question. So what are the common breastfeeding myths you hear most?
Well, I think a lot of people think it's going to be easy, or that if it's natural, it should be easy, which like, that's not often how these things go. Like, delivery isn't easy, right? And that's like maybe natural.
Even if like it's going to be painful right away. Like, when your milk starts coming in, it's kind of painful.
Yeah. And I hear that a lot, this idea that like, oh, it should never be painful. And I just like, I don't see that as realistic or actually the lived experience of people. I think as milk is coming in, it's painful because engorgement is painful. As your nipples are getting used to being fed on, and baby is figuring out how to feed, for most people there's discomfort, and it's, what does that mean? Is it pain? Is it discomfort? It's kind of finding that sweet spot. Is this tolerable or not? But what else? Well, when I come from a place as a nurse practitioner of this world of sort of tongue ties don't exist, it's not a thing, and I definitely don't believe in that anymore. It took me kind of a lot of training and extra hours and extra what's the word I'm looking for? Well, training and investment in gaining those skills, but to really find out that no, tongue ties are a real thing. But again, it boils down to the functional aspect, and it needs to be taken on a case-by-case basis.
And if we can kind of look at things and diagnose right away, I think there's this whole cascade of, now we're learning more and more about oral tension and how it affects kids when they're sleeping, and like behavioral issues and breathing and just things down the road. And if we can address it right away, it really helps the person in the long run.
100%.
Yeah. So what are some red flags that signal it's time to seek lactational support?
Yeah. Significant pain, or just like I always say, if mom isn't breathing, talking, she's feeding like this, that's a red flag. If baby seems excessively fussy or uncomfortable. Now, there is kind of a normal fussy period, right around 4 to 6 weeks of age. But if it feels excessive to parents, I would still say check in with somebody. If the latch looks shallow, so it looks like more just lips on the breast and kind of nibbling versus a big, nice, wide mouth on the breast, that would be a red flag. Nipple damage is definitely a red flag. Pumping shouldn't be painful. So if people are dealing with pumping issues or bottle feeding issues, those are reasons too. I see families all the time.
Are clogged ducts a sign?
Yeah, so they could be.
They could be.
Yeah. I do think there is some, our breasts are, as we're lactating, like they're filling and they're emptying and they're filling and they're emptying, and different breasts kind of experience that in different ways, I think, depending on the structure of the breast and just like mom's anatomy. So, but recurrent clogged ducts is definitely an issue. Mastitis, something's going on.
Okay.
Nipple bleb, so it looks like a little bit of a blister on the tip of the nipple. Those can be, they don't look like much, but they can be very, very painful.
Very painful.
And a lot of times our old recommendations on how to handle those things have been, we now know more, and now we know that it's often a bit more complex, and we're looking at more an issue of congestion in the breast and inflammation in the breast that's leading to these clogged ducts, mastitis, nipple blebs, that sort of thing. And so we can manage that, but the old recommendations have gone by the wayside. Thank goodness.
How about weight loss for
babies? So we do expect a normal weight loss in maybe that first couple of days to a week. And our goal is that babies are back to birth weight by 2 weeks of age. So if babies aren't getting there by 2 weeks, or if we are seeing a plateauing or actual weight loss in a baby at any point, definitely a question of what's going on with feeding. Why, sometimes I'll have families say, but we're feeding 14 times a day. We don't understand why our baby can't gain weight. And then we need to look, well, how hard is baby working to get that job done? Or what's going on with mom's milk supply? Or is the latch, are we not understanding the difference between active feeding versus sort of suckling and just soothing at the breast?
Okay. And is there such thing as reaching out to you too early?
No.
And I love the fact that you do the free consultation.
Anyone.
If you're going to take anything away from this.
I love to do prenatal consults with families, because to me it means like they are interested in learning and knowing that they're going to need to build their support system early. Often the people who do prenatal visits with me are second and third time moms who realize that the first time around they didn't have that set up. But I would encourage all families, if they don't have their like postpartum team sort of figured out, to figure that out before baby's born. And you can interview people, like you can do these free prenatal consults, you can ask around from friends or family, but figuring out like who's going to be on that team. And maybe you don't need them. I always tell people in a prenatal consult, like, hopefully you don't even need me. But if you do, now you know like where to find me and how to get to me.
And how do people find you?
So my website, bellflower.com. But families are absolutely welcome to email or text me. I am happy to have families reach out in any method that's easiest. Typically, I'm not the best with phone calls, only because I'm either with patients or my own children. And so it makes phone calls kind of hard, but texting is super easy, and email as well. And they can schedule directly through my website as well if they prefer.
You're amazing. Thank you for coming.
Thank you so much.
Thank you for sharing your knowledge and just your passion for what you do.
Thanks for all that you do.
Yes. Dr. Madeline, thank you for allowing me to be part of your health journey.